Hi, this is another case I would like to share with you, which is one of the patient. His name is Mr. Lau. Actually, he's a 61 years old Chinese gentleman. He came to me in November 2015 with a typical problem of heart disease symptoms, in which he had this chest pain and also shortness of breath when he walked a distance about 150 meters. So and previously he doesn't have that. And on top of that, he also need to take GTN, which is a nitrate medication, to open up the blood vessel to relieve his chest pain. Okay, so and every time he walk a distance after a distance. So besides he has this underlying heart disease, he also has this diabetes, high blood pressure problem, and high cholesterol diseases, which are on the multiple medication. He also is a very chronic smoker for the past 20 years. He smoked about 60 cigarettes a day. So and then keep me awake, for keeping alive, more energy. So beside that, he developed side effect due to this diabetic medication, which is insulin, in which he, in the middle of the night, he had to wake up due to hypoglycemia, which means he has a low blood sugar after taking overdose of insulin, and he had to take something in the middle of the night to relieve the hunger, and because of this hypoglycemia. In the morning, he has this very tiredness, exhausted the whole morning because of this whenever he take the insulin injection. So and due to this overall of uncontrolled diabetes, so he developed these infections on both hands, and the other doctors give the medication. The infection is not resolved even after about 3 weeks to 4 weeks now before he came to see me. Because of all these things, he's very frustrated, energy very low, and having chest pain and shortness of breath and all these bad symptoms. He came to us, and then we do a very thorough medical checkup, and also we try to find out the root cause of the problem. And then we found actually he has this fatty liver, and also he has this overdose of diabetic medication, and he has very, very bad diet, and also lack of certain nutrients in his body, and he has a very significant hormonal imbalances in his body as well. After all this investigation, then we laid out a plan, and then we give him this holistic treatment to him, which consists of a total detoxification program, ECP treatment of about 35 sessions, and also combined with the rehabilitation program, which consists of functional food therapy, nutritional replacement therapy, bioidentical therapy, as well as herbal therapy. He's within the 3 weeks, his skin of the hands is getting better. His blood sugar get then he doesn't have any craving at night, middle of the night. Because of the overdose of insulin, he feels more energetic in the daytime. He doesn't feel very tired. So, and then the insulin dose able to cut down, and also one of the diabetic medication also can be weaned off. With that, he become more energetic, he become more positive after we do this program to him. And we were also very intensified of educating him in terms of his diet. He make a lot of changes in diet as well. And he also back to exercise, because previously he walked distance, had shortness of breath, but now after the program he able to even can run for about 1 hour distance. All right, so with that he become happy. He's happy with the treatment, and the overall condition become better. And he's beside that, we also able to wean off one of his this cholesterol medicine, and also the high blood pressure medication. So after the treatment, overall his condition become better. And then from the investigation point of view, we also found actually his blood sugar become much better, well controlled, not fluctuating anymore. And also his we done some tests, actually, like the blood test analysis. And then we see previously he has a lot of crystal, a lot of toxin inside the blood, and the red blood cell all clumping up together very badly. And after the detox and also combination therapy, his blood become more alkaline, and then the crystals disappear, right? So and then beside that, his free radical test that we done on him shows that it's very high level. After the treatment, is actually almost back to normal, right? So overall, I would say that he's motivated after the treatment, and he's able to back to work. Last time, which is before he came to us, he can't even walk a distance to do his work, his own work. So he's back to work and then back to his field. So, and his condition of his nutrition also improved along the way after we give him the treatment. As a result, overall things that we have done, so we can conclude that he has no longer having chest pain and shortness of breath. He's no longer relying on the medication to relieve his chest pain, which is called GTN. And I told you that actually he's able to run more than 1 hour without any shortness of breath. His day pass totally changed. He's no longer craving too much of carbohydrate because of the overdose of medication, of diabetic medication. He's happy. He's back to work, and then he no longer feel tired throughout the days. And the dose of insulin has been reduced. And with that, you can see that he's improved his quality of life. And from here we can see that we managed to help him to reduce the side effect due to the medication itself. And then overall nutrition status is able to bring up, as well as hormonal status as well. So this is my case sharing to you. I think I feel more excited to help this patient because he also feels excited and more optimistic after the treatment we're giving to him.